Let me ask you something that your doctor has probably never asked you. Not about your medications, not about your diet, not about your exercise routine. Something far more basic. Something hiding right there in your kitchen, in your bathroom, in your morning routine every single day. When was the last time you thought carefully about how you drink water? Not just how much, how, when, at what temperature, and with what inside it. I know what you're thinking. Doctor, water is water. I've been drinking it my whole life. And yes, you have. But I want to share something with you today that has quietly transformed the blood sugar results of dozens of patients walking through my clinic. People who, on paper, were doing everything right and still couldn't get their numbers under control. People who were frustrated, exhausted, and starting to wonder whether it was even worth trying anymore. By the end of this video, you are going to understand why dehydration is one of the most misunderstood and underestimated drivers of blood sugar instability in adults over 60. And you're going to walk away with a complete step-by-step protocol you can start tomorrow morning. No prescription needed, no expensive equipment, no dramatic lifestyle overhaul. Stick around, because in about 12 minutes, I'm going to introduce you to something called the CLEAR method. 4 targeted hydration strategies that directly support insulin function and blood sugar stability. You've probably never heard it explained quite this way before. So, let's get into it. Why blood sugar and hydration are deeply linked. My name is Dr. Michael Adeyemi. I work in the space of preventive health and longevity for older adults. And the question I'm always asking on behalf of my patients is this: what is the body quietly asking for that we're not giving it? After the age of 60, your body goes through a series of physiological shifts that nobody really prepares you for. First, your cells become gradually more resistant to insulin. Think of insulin as a key and your cells as the locks. When you're younger, that key slides right in. After 60, the lock starts to get stiff. It takes more insulin to do the same job. And if your pancreas can't produce enough to compensate, glucose starts accumulating in your bloodstream instead of being delivered into your cells where it belongs. Second, your pancreas, the organ responsible for manufacturing insulin, doesn't produce it as abundantly as it once did. So you're dealing with a stiffer lock and fewer keys at the same time. That's a double challenge that most blood sugar management advice doesn't fully account for. Third, and this is the one that tends to surprise people most, your kidneys become less efficient at filtering excess glucose out of your blood, so sugar lingers, it accumulates. It shows up in your fasting numbers, your post-meal spikes, your A1C. And it's frustrating because you may be doing absolutely everything your doctor told you to do, and the numbers are still stubbornly high. Before we continue, press that like button and subscribe to the channel. It only takes 3 seconds. I will upload more health-related tips for you. Now here's where water enters the picture, and this is the part I want you to really sit with for a moment. Your blood is a transportation system. Everything your body needs, oxygen, nutrients, glucose, insulin, travels through that system. When you are properly hydrated, your blood has the right viscosity, the right thickness to flow efficiently. Glucose gets picked up, transported, and delivered to cells that need it for energy. Insulin circulates properly and connects with your cells the way it's designed to. But when you're even mildly dehydrated, and I mean just 2% below optimal hydration, which you may not even feel at all, your blood becomes more concentrated, thicker. Glucose gets stuck in that thickened bloodstream instead of being moved efficiently into your cells. The result? Your blood sugar readings climb. Not because you ate something wrong, not because your medication isn't working, but because your blood simply couldn't do its job properly. Research published in peer-reviewed journals confirms that mild dehydration can raise blood glucose levels by 10 to 15 points. For someone already walking a fine line between good control and poor control, that is the difference between a fasting reading of 118 and a reading of 133. That's the difference between your doctor saying, "Great work, keep it up," and "We may need to adjust your medication." Those 10 to 15 points matter enormously, and they are often entirely within your control. Now here's the piece that catches most seniors completely off guard. The thirst mechanism, that internal alarm system that's supposed to tell you when you need water, becomes significantly less sensitive as you age. This is not a personal failing, it's biology. Your hypothalamus, the part of your brain that monitors hydration and triggers the sensation of thirst, simply becomes less responsive over time. You can be meaningfully dehydrated and your mouth won't feel dry. You won't feel desperately thirsty. Your body has lost the sensitivity to send you those early warning signals. That means if you're waiting until you feel thirsty to reach for a glass of water, you are already behind. Every single day, without even knowing it. The 4 hydration mistakes seniors make. Before I walk you through the clear method, I want to name the 4 most common hydration mistakes I see in my patients. Because understanding what's going wrong is just as important as knowing what to do differently. Mistake number 1, treating thirst like a reliable guide. I already mentioned this, but it bears repeating because it is so fundamental. The thirst reflex in adults over 60 can lag significantly behind your actual hydration status. By the time you feel thirsty, your blood has already thickened, your glucose has already started to creep upward, and your insulin is already working against unnecessary resistance. Thirst is not a hydration strategy, it's a late alarm. Relying on it is like waiting for your smoke detector to go off before you check on the stove. Mistake number 2, drinking large amounts all at once to catch up. Some people go 6 or 7 hours without water and then drink a full liter in one sitting, thinking that will compensate. But your gastrointestinal system can only absorb roughly 200 to 250 milliliters of water every 15 minutes. That's about 1 cup. Anything beyond that doesn't get absorbed by your cells. It passes directly into your bladder. So drinking an entire liter in one go doesn't hydrate you 4 times better. It results in 4 urgent trips to the bathroom and a false sense of security. Think of it like watering a garden during a drought. If you dump a full bucket on dry, hardened soil all at once, most of the water runs straight off the surface. The roots stay dry. But if you water slowly and steadily, the soil absorbs it layer by layer, and the roots get what they actually need. Your body works exactly the same way. Mistake number 3. Ignoring the morning hydration window. When you wake up in the morning, you have been without water for 7 to 9 hours. During sleep, your body continues to lose moisture through breathing, perspiration, and ongoing cellular processes. You wake up every single morning in a mild but meaningful state of dehydration. And yet many seniors don't drink any plain water for another hour or 2 after getting up. And when they do reach for something first, it's often coffee, which has a mild diuretic effect that compounds the problem. This creates a window of dehydration that sets your entire metabolic tone for the morning. It is one of the primary reasons so many of my patients have unpredictable elevated fasting blood sugar that doesn't seem to connect with their dinner, their medication timing, or anything else they can identify. The culprit is the morning hydration gap, and it is entirely fixable. If you are still there and drink water in morning, tell me in comments honestly. Mistake number 4, drinking ice-cold water exclusively. Cold water is refreshing. I understand the appeal, but it causes your blood vessels to contract slightly, a physiological response called vasoconstriction. When your blood vessels narrow, circulation becomes less efficient. Insulin has a harder time reaching the cells that need it. Room temperature or slightly warm water keeps your blood vessels naturally relaxed and open, which creates the best possible environment for insulin to circulate and do its job. This matters most in the morning and around meal times, precisely when your body is managing its biggest glucose fluctuations of the day. The clear method, your complete senior hydration protocol. All right, let me give you the framework that ties all of this together. I call it the clear method. Clear is an acronym: consistent, layered, early, additive, and responsive. Each letter represents a core principle of hydration that specifically supports blood sugar regulation in older adults. Let me walk you through each one. C. Consistent. Your body runs on rhythm. Consistency is the most underrated principle in health management, full stop. Your metabolism operates on circadian rhythms, predictable biological cycles that govern hormone release, digestion, glucose metabolism, and much more. When you introduce water at consistent scheduled times every single day, you're not just hydrating. You're reinforcing the stability of those metabolic rhythms. Instead of drinking randomly throughout the day, whenever you happen to remember, I want you to anchor your hydration to your existing routine. Before your morning coffee, before every meal, after your walk. One final glass before bed. Same times, same amounts, every day. Within 2 to 3 weeks, your body will begin anticipating those hydration windows. and your blood sugar patterns will begin to reflect that stability. L. Layered, small amounts. Frequently remember the absorption limit, about 1 cup every 15 minutes. So instead of drinking large amounts infrequently, you want to layer your water intake throughout the day in consistent, modest amounts your body can actually process and use. A practical way to implement this: fill a 24-ounce reusable water bottle first thing in the morning and commit to finishing it by noon. Refill it and finish it by 5 p.m. A final, smaller glass in the evening before bed. That alone gets most adults to their daily target, spread across the day in a way that supports steady cellular hydration rather than flushing straight through. Keep that bottle visible. On your kitchen counter, beside your reading chair, on your desk. Visual cues are among the most reliable behavioral triggers we know of in health psychology. Out of sight genuinely is out of mind when it comes to hydration. E. Early. The morning window changes everything. This is the single highest leverage hydration habit I can give you. It costs almost nothing, takes less than 5 minutes, and I have seen it move fasting blood sugar numbers by double digits in patients who implemented it consistently. The moment you wake up, before coffee, before breakfast, before you reach for your phone, drink 1 full glass of warm water. About 350 milliliters, roughly 12 ounces. And I want you to add 2 specific things to it. First, a small pinch of natural sea salt or Himalayan pink salt, not table salt, which has been chemically stripped of its trace minerals through processing. Natural, unrefined sea salt contains sodium, potassium, and magnesium in proportions that help your cells actually absorb the water you're drinking, rather than allowing it to pass straight through. This is the physiological difference between hydrating your cells and simply filling your bladder. Second, the freshly squeezed juice of half a lemon. Lemon juice contains compounds that support a more gradual rise in blood glucose after your first meal. It also creates a slightly more acidic environment in your stomach that slows carbohydrate absorption, exactly what you want first thing in the morning when your metabolic sensitivity is at its highest point of the day. Now let me explain the deeper reason why the morning timing matters so much, because once you understand this, you'll never skip it again. Every morning, your adrenal glands produce a natural surge of cortisol, your primary stress hormone. This is completely normal and healthy. Cortisol signals your liver to release stored glucose into your bloodstream, providing energy to get your day started. The problem is that if you wake up dehydrated and don't address it, that cortisol surge happens on top of already thickened blood. The glucose your liver releases has nowhere to go efficiently. It accumulates in your bloodstream before you've eaten a single bite. And that is what's behind those mystifying fasting readings that don't match anything you ate the night before. Proper morning hydration, warm water with a mineral base and lemon, dampens that cortisol spike, supports liver function, and gives your blood the right consistency to handle the morning glucose release efficiently. I have seen this single change reduce average fasting blood sugar by 12 to 18 points in patients who implemented it consistently for 4 weeks. Not every patient, and not overnight, but consistently and measurably. If you are finding this information valuable, press that like button and subscribe to the channel. A. Additive, strategic additions that support insulin function. The morning drink I just described is one example of what I call additive hydration, water that carries therapeutic value alongside the fluid itself. And there is one more addition I want to bring to your attention that deserves its own conversation. Magnesium. Magnesium is an essential mineral that participates in over 300 enzymatic processes in the human body. One of its most critical roles is insulin signaling. Without adequate magnesium, your insulin receptors, those stiff locks I mentioned earlier, become even stiffer. Your cells become less responsive to insulin regardless of how much insulin is present. Study after study consistently shows that magnesium deficiency is associated with higher insulin resistance and poor long-term blood sugar control. And here is something that should genuinely concern every senior watching this. The majority of adults over 60 are deficient in magnesium. The reasons are multiple: reduced dietary intake, decreased intestinal absorption that comes with aging, and increased urinary excretion that is accelerated by both the aging process itself and by common medications that many seniors are already taking, including diuretics and proton pump inhibitors. My recommendation: about 1 hour before bed, Dissolve 200 milligrams of magnesium glycinate or magnesium citrate into a warm glass of water and drink it slowly. Magnesium glycinate is my preferred form. It is highly bioavailable and far less likely to cause the digestive discomfort that cheaper forms of magnesium can sometimes produce. This pre-sleep dose serves double duty. It directly supports insulin sensitivity overnight, and it promotes deeper, more restorative sleep, which itself has a direct and measurable effect on next morning blood sugar levels. Poor sleep raises cortisol. Elevated cortisol raises blood glucose. Better sleep, through the simple addition of magnesium to your evening water, can break that cycle. Before adding any supplement, please speak with your physician, especially if you have kidney disease or any condition affecting how your body processes minerals. For most seniors, this is safe and highly beneficial, but your doctor needs to know your full picture. Responsive. Adjust to what your body is actually doing. The final principle is responsiveness. Adjusting your water intake based on your activity level, your environment, and the real demands your body is facing at any given time. If you walk, garden, do household chores, or engage in any sustained physical activity for more than 20 minutes, your hydration needs increase significantly. I recommend approximately 100 to 120 milliliters, about half a cup, every 15 minutes of sustained activity. And critically, begin drinking during the activity, not just after. By the time you've finished your walk and feel like you need water, you are already behind. There is also a pre-meal hydration habit I want every senior managing blood sugar concerns to adopt immediately. 15 minutes before lunch and dinner. Not during, not after, 15 minutes before. Drink 1 cup of room temperature water. Just 1 cup, nothing added. Here's what that simple habit does physiologically. It primes your digestive system, stimulating the production of enzymes and stomach acid needed to break down your meal more effectively. And more relevant to our purpose here, it creates a slight physical volume in your stomach that slows gastric emptying, the rate at which food leaves your stomach and enters your small intestine. Slower gastric emptying means carbohydrates from your meal enter your bloodstream more gradually, giving your available insulin time to keep up rather than being overwhelmed by a sudden surge of glucose. Clinical data supports this. Pre-meal water consumption has been shown to reduce post-meal blood sugar spikes by up to 20%. That is a significant and meaningful number. The kind of number that compounds positively in your A1C over a full quarter. Temperature matters more than you think. I want to make sure something lands clearly before we move on, because it is easy to dismiss as a minor detail when it actually isn't. Water temperature matters for blood sugar management. The optimal range is between 22 and 26 degrees Celsius, room temperature to slightly warm. At these temperatures, your blood vessels remain naturally dilated, circulation is efficient, and insulin moves freely through your vascular system to reach your cells the way it is designed to. Ice-cold water, especially consumed first thing in the morning on an empty stomach or right before a meal, triggers a reflex constriction in your blood vessels. This doesn't completely block insulin from circulating, but it reduces the efficiency of its delivery. Across multiple meals, across every day, that reduced efficiency accumulates into measurable impact. I'm not telling you to never drink cold water. On a warm afternoon after physical activity, cold water is completely fine and frankly enjoyable. But for your morning hydration ritual and your pre-meal glass, choose warm or room temperature. It costs you nothing extra and gives your insulin every advantage it can get. How much water do you actually need? Let me give you a formula that is simple, practical, and doesn't require any apps, tracking tools, or math beyond basic division. Take your body weight in pounds, divide that number by 2. That result, in ounces, is your baseline daily water target. If you weigh 160 pounds, your baseline target is 80 ounces. That's approximately 10 standard cups, or roughly 2.4 liters across the day. If you are physically active or live in a warm climate, add 1 extra cup for every 20 minutes of physical activity or significant heat exposure. Now, how do you know if you're actually hitting that target? Look at your urine color. I know that sounds clinical, but it is genuinely one of the fastest and most accurate real-time indicators of your cellular hydration status available to you. Your target color is pale straw yellow, similar to very diluted lemonade. If your urine is completely colorless, you may actually be overhydrating, which creates its own electrolyte imbalances. If it is dark yellow, amber, or orange, you are dehydrated, and your blood is thickened enough that it is very likely affecting your glucose readings. Pale straw yellow is the target. Check it every morning. It takes 3 seconds and tells you more than most people realize. What to realistically expect. I want to be honest with you about the timeline, because I think you deserve honesty more than you need encouragement. The truth here is compelling enough on its own. In the first week of implementing the clear method, expect frequent bathroom trips. Your body is recalibrating. This is temporary. It typically settles significantly by week 2. And it is actually a positive sign that your kidneys are flushing waste products that had accumulated during a period of chronic mild dehydration. By the end of that first week, you should start to notice morning blood sugar readings that are slightly more stable, perhaps 8 to 15 points lower on average. Not a dramatic transformation, but a consistent and directional improvement. By weeks 2 and 3, energy stability often improves noticeably. That familiar afternoon energy slump that many seniors attribute to aging or their medication is frequently, at least in part, a hydration slump. Post-meal readings become more predictable. The unexplained highs that seem to come from nowhere start to settle. By the end of month 1, if you've implemented the full clear protocol with genuine consistency, you may begin to see meaningful downward movement in your A1C at your next lab check. Not a cure, not a miracle, movement in the right direction, which, when you've been staring at frustrating numbers for months or years, can genuinely feel like one. I had a patient, a 74-year-old retired teacher, who came back after 6 weeks of committed implementation and told me something I've never forgotten. He said, "Doctor, I thought you were sending me home with homework I'd forget by Tuesday. But these were small enough changes that I actually did them, and then I couldn't argue with what I was seeing on my own meter." His fasting glucose average had dropped 19 points in 30 days. No medication changes, no dramatic dietary overhaul, just water, timed right, the right temperature, with the right additions, in consistent and layered amounts. Important medical disclaimer. Before we close, I need to be absolutely clear about something. Everything I've shared today is designed to work alongside your current medical care, not to replace it. Do not stop your diabetes medication. Do not discontinue any supplement or treatment your physician has prescribed. If anything you've heard today sounds like it might interact with your current management plan, bring it to your next appointment and talk it through with your doctor directly. If you have kidney disease, chronic kidney dysfunction, or any condition affecting fluid balance, please speak with your physician before significantly increasing your water intake. For the vast majority of seniors, the clear method is safe, practical, and supported by evidence. But your care team knows your full medical picture, and they should always be part of any meaningful change you make to your daily routine. So let me leave you with this. You have probably spent years looking for the next significant answer to your blood sugar challenges. A new medication, a better meal plan, a supplement your neighbors swore worked for them, and some of those things have genuinely helped. But the foundation, the thing that makes every other intervention work more efficiently, is something you have access to right now, today, at almost no cost. Water, timed right, the right temperature, with the right additions, in consistent layered amounts that your body can actually absorb and use. The clear method: consistent, layered, early, additive, responsive. Write those 5 words down. Put them on your refrigerator. Start tomorrow morning with 1 glass of warm water with a small pinch of sea salt and fresh lemon juice. Before your coffee, before your breakfast, before anything else. That is the first step, just that one thing. If this video gave you something practical and useful, something you're going to actually implement, please hit the like button. It helps this information reach other seniors who are quietly struggling with the same challenges you've been facing. Subscribe if you haven't already, because every week I bring you the kind of evidence-based, practical guidance that your doctor genuinely wants to give you, but rarely has enough appointment time to cover in full. Drop a comment below. Tell me where in the world you're watching from. Tell me which part of the clear method you're starting with tomorrow. I read every single comment, and I would genuinely love to hear from you. I'm Dr. Michael Adeyemi. Take care of yourselves out there. I'll see you in the next one.